Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. The Living Will. Introduction. Advance directives are instructions you give your doctors telling them what kind of medical care you do or do not want if you become unable to make medical decisions for yourself. In a living will, you specify the medical care you do or do not want to receive if you become unable to make decisions for yourself. Living wills usually apply to end-of-life situations. This tutorial explains living wills. It is for informational purposes and does not replace the advice of your doctor or lawyer. Advanced directives. Many terminally ill patients become unable to make decisions or let their doctors know their wishes as the illness gets worse. If a patient cannot make decisions or communicate and does not have an advance directive, doctors have no way of knowing whether or not the patient wants to be treated. The best time to write a living will stating which treatments are or are not wanted is while a patient can still make decisions and communicate them. Because it takes effect while you are still living, it is called a living will. It is different from the will you will write to dispose of property, which takes effect only at death. Examples of medical situations where a person can no longer make decisions include being in a permanent coma, also called a permanent vegetative state, losing the ability to think competently, such as after a massive stroke, losing the ability to think and communicate due to severe dementia. Living will. A living will comes into effect while you are still alive but unable to make decisions. It specifies the medical care you do or do not want to receive if you become unable to make decisions for yourself. A simple living will can include a statement such as, "If I should have an incurable or irreversible condition that will cause my death within a relatively short time, or a state of permanent unconsciousness from which to a reasonable degree of certainty there can be no recovery, it is my desire that my life not be prolonged by the administration of life-sustaining procedures. If I am unable to participate in my healthcare decisions, I direct my attending physician to withhold or withdraw life-sustaining procedures that merely prolong the dying process and are not necessary for my comfort or freedom from pain." Many hospitals have a Do Not Resuscitate Order form, also known as DNR-Order or Allow Natural Death Order. In it, a patient can request not to be resuscitated. In addition, a living will can include an order not to resuscitate. In addition to protecting the patient's rights to communicate his or her decisions in advance, a living will removes the burden of making difficult decisions from family and friends. A living will can include a person's wishes regarding resuscitation, life-sustaining procedures, palliative care, and aggressive treatments. However, it cannot cover all medical scenarios. This is why appointing someone to make medical decisions for you when you cannot make them for yourself is important. Some treatments that are not available now may someday become available. The laws in your state may also change. Because of this, you should include all of your wishes in your advance directives, even if the treatments or wishes are not available or legal currently. Doctors who refuse to honor your advance directives are required in many states to make efforts to transfer you to another provider who would comply. Your doctors may not have an obligation to inform you ahead of time whether they would honor your wishes, so ask them. Hospitals and healthcare institutions, on the other hand, are supposed to inform you at the time of admission. Most hospitals and healthcare facilities, such as nursing homes and home healthcare agencies, are required to observe the following patients' rights: give you a written summary of your healthcare decision-making rights at the time of admission, ask you if you have advance directives, and document that fact in your medical record. However, it is up to you to give them a copy of your advance directives. Never require that you have or not have advance directives, or discriminate against you based on whether you have them or not. Make the facility's policies available regarding recognizing advance directives. Since some healthcare facilities and providers may not honor certain wishes in advance directives, it is very important for patients and healthcare staff to maintain good communication. You should discuss your wishes with your doctors, understand your treatment options, and find out whether or not they can honor them.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Other directives. The living will is one form of advance directives. However, there are other advance directives as well. The durable power of attorney for healthcare and your desires regarding organ donation after death are also advance directives. A durable power of attorney for healthcare lets you name another person to make medical decisions for you if you become unable to make and express your own decisions. The agent you name acts as your appointed proxy, but only for making decisions regarding the healthcare matters you specify and when you cannot make the decisions yourself. Many states use ID cards and hospitals use forms to ask if you would like to donate your body organs after death. Answering yes or no to such questions is a form of advance directive. In general, people dying of a chronic illness can donate only corneas, skin, and bone. People who die unexpectedly generally can donate more organs, such as kidneys, liver, heart, and lungs. Some hospitals have a special form called a Do Not Resuscitate DNR-Order form. It is another kind of advance directive. A DNR is a request not to have cardiopulmonary resuscitation, CPR, if your heart or breathing stops. Unless given other instructions, hospital staff will try to help anyone whose heart has stopped or who has stopped breathing. You can also include in your advance directives your wishes regarding nursing homes, blood transfusions, autopsies, donating your body for medical research, and any other issue of importance to you. The living will, durable power of attorney for healthcare, DNR-Order, and organ donation are all forms of written advance directive. It is possible to combine forms into one legal document that lists a patient's wishes regarding medical treatment and appoints an agent. Such a legal document is usually called advanced-health-care-directives. Legal Advance Directive AD forms. State laws govern advance directive documents. All 50 states and the District of Columbia have laws that permit individuals to sign documents stating their wishes about healthcare decisions when they cannot speak for themselves. The laws vary from state to state, but the basic idea of honoring a patient's wishes is the same across the United States. You do not need a lawyer to write advance directives. Most states have laws that provide special forms. However, use a lawyer if you think your family situation is complex or if you expect problems to arise. Since living wills apply mostly to end-of-life situations, they cannot be used in cases of temporary coma. For this reason, it is best to write both a living will and a power of attorney for healthcare. You can also combine the forms in one legal document called the advance-health-care-directives. Many states have this comprehensive form. Some states have forms for a living will and a durable power of attorney for healthcare. Some recognize one form only, and other states combine the two forms into one. If your state form does not allow you to express all your wishes, you can attach an additional page to the form recognized by your state. To obtain advance directive forms that are specific to your state, ask for the forms at your hospital or healthcare facility. You can also check with your state's medical or legal association. If you use a computer, your state forms may be available online. You can also buy computer software packages that provide the legal forms for your state. The laws in your state specify who can and cannot be your healthcare agent. Make sure your healthcare agent meets the criteria. Most states prohibit your doctor and other healthcare professionals from being your agent unless they are related to you. Plan before you fill out your advance directive forms. The following tips are also discussed in the Planning for AD section. 1. Consider your values and specify your goals. 2. Understand your treatment options and outcomes. 3. Specify your wishes. Specify how much authority you want your healthcare agent to have. It can be unlimited, or can follow your wishes in the living will. If your state does not have a living will form, attach a statement to the durable power of attorney document stating the limitations or power of your agent, if you have any. State laws may put restrictions on what an agent can order. For example, an agent cannot order an abortion. When you are satisfied with your directives, the document should be notarized or signed according to your state's requirements. States usually require 2 witnesses. Some require or permit a notarized signature. It is very important that you follow your state's requirements, which are explained on your state form. After signing your advance directive, give copies to your durable power of attorney for healthcare, your family, and your doctor. You may want to keep a small card in your wallet or purse indicating that you have advance directives. You can review your advance directives at any time. Inform your doctor, attorney, healthcare agent, and family of any changes. Changes must be made, signed, and notarized according to the laws in your state. It may be as easy to write a new medical directive instead of changing the current one, since the signing requirements are the same. In most states, advance directives are in effect until you cancel them or change them. In some states, they expire, and you have to renew them every few years. Check your state forms for instructions. You can cancel your advance directives verbally or in writing. However, it is best to do it by writing a new directive. Remember to sign it according to your state rules, and then give it to your agent, doctors, or anyone else who has a copy of the previous directive. Destroy your old copy and ask them to destroy their old copies. Preparing for AD. Merely filling out an advance directive form will not help you if it does not reflect your wishes. To have the advance directives reflect what you want, you need to identify your values and goals and understand your treatment options and outcomes. The type of medical care you want in a terminal illness depends on your beliefs and values. Beliefs and values may be based on religious, social, financial, or other considerations. They also depend on your self-image regarding the need for independence, dignity, and the ability to communicate with others. You should consider your whole value system before deciding on a goal statement that will guide others if you cannot express yourself. Your goal statement could be one of dozens of statements, such as, I want to receive all medical treatment possible, no matter what my condition is, or, I would like treatment to stop if I am in a state of permanent unconsciousness, or, I do not want to prolong my life if I am in severe continuous pain that cannot be controlled, or, I do not want to prolong my life if I cannot think, talk, and respond to commands. You need to understand the diagnosis, the treatment options, and their outcomes to be able to state your wishes. Ask your doctor for information. Do you understand the difference between terminally ill and irreversible coma? Do you know what resuscitation, respirator, tube feeding, and kidney dialysis mean? If you are healthy now, it is difficult to know what disease or sudden injury you may have in the future, or what the alternative treatments or likely outcomes might be. That is one of the reasons why appointing a healthcare agent is important. Write instructions carefully so that they do not restrict the authority of your agent in ways you did not intend. For instance, do not say, I do not want a respirator, if you really mean, I do not want a respirator if I am permanently unconscious. Some statements can limit your healthcare agent, so specify if they are guidelines to be followed or strict wishes. The more you trust your healthcare agent, the more you should set guidelines rather than strict wishes. If you have a terminal illness, talk to your doctor about the treatment options and how they may affect your quality of life. Ask how they may affect your independence, pain level, and mobility. Check about your pain medications and comfort care options. Finally, decide what health care you would want in a life-threatening situation. Relate your treatment options to your values and check which options fit your stated goal best. You can be as specific as you want. For instance, you can say, I do not want a respirator when terminally ill, but I want nutrition, hydration, pain management, and kidney dialysis.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Conclusion. A terminal illness or sudden injury can leave you unable to convey your decisions regarding your medical care. Advanced directives tell your doctor what kind of medical care you would like to receive if you become unable to make medical decisions. The two main types of advanced directives are the living will and the durable power of attorney for health care. In a living will, you state your wishes about life-sustaining medical treatments if you are terminally ill. In a durable power of attorney for health care, you appoint someone else to make medical treatment decisions for you if you cannot make them for yourself. Laws about advanced directives vary from state to state. You should use the forms for your state. Forms should be available in hospitals, healthcare facilities, and your state medical and legal associations. Consult an attorney if you think your family or medical situation is complex. Advanced directives are not only for the elderly. Incapacitating accidents can hit anyone at any age. The time to write your advanced directive is when you can still communicate your desires. This way you will ensure that your healthcare wishes will be followed and may relieve your family members of the burden of making difficult healthcare decisions for you.
Thank you for using Explain.